rise in New York City.
So nowhere near, right, the devastating levels of 2020, of course. But on the 4th of July, we did have a 7-day average of 230 cases. And at the end of the month, that went up to about 566.
Yeah, City Health and Mental Hygiene Commissioner Dr. Ashwin Vasan is here to explain things to us. So, Doctor, good morning. Thanks for joining us on the Pix 11 Morning News.
Morning. Good to see you.
Yeah, good to see you too. So what's happening exactly? Because some people are wondering, should we be concerned? There's a large percentage increase in COVID in the past month. Should we worry about that?
Yeah, right. There has been an increase. Since mid-July, we've seen, as you reported, a slight uptick. We're still at low levels overall. Cases are up. Hospitalizations are slightly up. And remember, for the last year, we've seen most of those hospitalizations be people who were admitted for something else,
Right.
but then tested positive, which makes sense, right? If you have more COVID circulating, the likelihood that you're in the hospital and you test positive is higher. The good news is that we're not seeing anything in the virus that suggests it's getting more transmissible or more lethal. What this really is just waning immunity. And it's going to be an effort for us going into the fall to get people to say, all right, let's get that booster. We're going to have a new booster coming online in September or early October per the CDC. And that's going to be updated to match the current variants. And it'll give us protection going into the winter and fall season.
Yeah.
This is part of living with COVID. And so these fluctuations are to be expected.
Yeah, and I want to get questions about that vaccine and the booster in just a second. But that 566 number, that's just what was reported, right? Because so could there be more numbers based on the fact that many people may just not be testing anymore because it's just the new norm?
Well, that's right. I mean, and then you look at our wastewater surveillance, right?
Right.
Which we analyze regularly. We started to see an uptick a little bit earlier than July, towards the end of June. So yes, there is more COVID circulating than we're capturing on recorded testing. That's always been the case. But what we are saying is that if you have symptoms that you think might be a part of COVID or might be related to COVID, go get tested.
Okay.
You can still pick up tests at your pharmacies, at your doctor's office, at libraries across the city. You can still go get tests. If you test positive, call your doctor, call 212 COVID-19, get treated. And of course, if you're not symptomatic and you've been more than 6 months since your last shot, get boosted. Get boosted now, or even wait until September and get that new booster when it's updated.
But how serious are these cases, though, that you're getting? Have you seen an increase in deaths due to COVID as well?
We have not. We have not. And that's really encouraging. That tells us that this is evolving to be the kind of coronavirus that will be seasonal, circulating like many other coronaviruses that we see. That said, one thing we've learned over the last 3 years is to never always be vigilant and never be surprised if this virus changes. So I always have to keep that caveat in play because we just don't know what will happen next. But nothing points to the direction of this being more lethal or more transmissible or anything that New Yorkers should be overly concerned about. It's just about really taking care of yourselves and each other.
Right. And is it a new strain?
No, we are seeing new variants, but they're really just they're subvariants of previous ones. We're not really seeing a dominant new. It's like a variant soup, as we've said in the past.
Good point. So that booster that you're talking about, right, that people should be getting, there was a lot of talk, and I think we spoke to you once before about this, whether or not it was going to be combined with a flu shot, right? So you can get both kind of at the same time. So is that what's being looked at for the fall, or are they still going to be two separate shots?
At this point, I think we're looking at two separate shots. The one that's being designed and that's seeking FDA and CDC approval is tailored towards XBB 1.15, and that's really related to all these sublineages that we're starting to see. So we think that will give us the best coverage going into the winter. But as I did last fall, as I'm going to recommend again this fall, New Yorkers should go get boosted and get their flu shot at the same time. It's safe, it's effective, the side effects are minimal, and it gives great protection going into the annual viral season into the fall.
I mean, I know we can't predict the future, but if the numbers do go up, is the city going to be providing clinics again like they did before with free vaccinations?
No, I think what we're really transitioning into a moment where our routine healthcare system is taking on the majority of the work. That includes our public hospital system, but but also the many other health systems out there in New York City are taking on the bulk of the work to do testing, treatment, and follow up of COVID. Now, for people who are underinsured or uninsured or don't have access, there are programs that the city's working on with the federal government and separately to ensure that people can get access to vaccination at no cost, and access to other tests and treatment at low or no cost. And so we're trying to make sure that no one falls through that cracks. But
Yeah.
for the majority of people, testing, treatment, and vaccination will remain free through insurance.
Good. And lastly here, for that booster you're talking about, that's for everybody, children all the way to adults. Like if you're in the younger population, you should still get the booster every single year, right?
Yeah, that's our recommendation. I mean, the booster is available to everyone, from zero to adults, to the elderly. Obviously, if you fall into a particularly high risk group, if you're a very young child or a much older adult, or if you have underlying chronic conditions, that really tells you you should be first in line. But it's a recommendation to all New Yorkers as we enter the fall season.
All right, Dr. Vossen, New York City Health and Mental Hygiene Commissioner. We appreciate your time this morning.
Thanks for having me.